Schools in San Diego prepare for the upcoming semester online. What impact will distance learning have on our kids? Joining us to discuss the mental health impact of virtual learning among children is the president and CEO of the San Diego Center for Children, Dr. Moises Barone. Hey, Dr. Barone, how are you doing?
Good morning. Thanks for having me.
Well, let's broad stroke. I think everybody in the school district, from Cindy Martin on down, will say that, yeah, distance learning is not ideal, but considering COVID-19 and the pandemic that we're surrounded with, it is our best option. What do you say to them?
Fully understand the reasons why this decision has been made. I think that what we need to consider at this point is how to best respond to these new circumstances. We understand, well, to begin with, even before the pandemic, there were already indicators to suggest that many of our children were experiencing mental, emotional, behavioral challenges, and they were not getting the help they need. We need to be very, very proactive at this point in identifying these challenges and be able to respond, knowing that the schools are not going to be in session and they're going to be in a virtual world.
So we've had experts like Dr. Scott Atlas on who says that, the decision is wrong and that more kids will suffer, especially at high-risk kids, will suffer at a higher rate than, say, the wealthier kids who can have access to high-speed computers and broadband and whatnot. That distance learning is not going to be as destructive to the wealthier kids as opposed to the high-risk kids. Does that apply to mental health as well?
I think that, first of all, mental health can impact anybody, can impact children from all socioeconomic levels, can impact kids from all ages. So I think that we need to be aware of that. The part that we need to be very concerned about, given this new reality, is that the schools provide many of the mental health services that our children and adolescents get. As a matter of fact, there's a report from the Journal of American Medical Association of Pediatrics that about 57% of adolescents who needed care were getting this treatment or this help from schools. So what is really important now is to identify what schools can do to be proactive and strategic in being able to reach out to those who may need help, and also what families can do to identify if their child is experiencing challenges and how to seek help under these conditions, and we can talk about that.
Aren't we putting a lot of pressure on parents? We're asking them now to be teachers, and now we're also asking them to be mental health experts, are we not?
What we're asking, there is no doubt that this is creating tremendous pressure on families. And this is something that we're seeing and working with a lot of families throughout the county. This is definitely creating a lot of pressure. Actually, this pandemic is impacting everybody, it's impacting families at all levels, and we need to be aware of that. The question is, how do we come together to be able to provide the resources, to be able to provide the know-how, to allow everybody to play a role in this? So parents play a role, not necessarily in providing the care, but being able to identify whether or not their child is experiencing difficulties, and to understand that the resources are still available through telehealth. So reaching out to their school, reaching out to the counselors in the school, reaching out to the pediatrician or to organizations like us, at the San Diego Center for Children, to be able to identify how we can be of assistance and how we might be able to deploy telehealth services, which can be effective. It's important for families to know that telehealth can be effective. It's a good option, and we need to mobilize it at this point and be proactive.
Dr. Barone, are you sympathetic at all to the argument that the risk of distance learning outweigh the risk of having kids go to school face-to-face amid COVID-19?
I think that we're talking about different things here, because on the one hand, we're seeing it in our organization and with our staff and with the youth that we care. We run a residential treatment center, and we are providing care face-to-face throughout this whole pandemic. As a society, we need to weigh the impact that this is having from a health perspective, and the fact that the indicators are very clear that things unfortunately are moving in the wrong direction. Now that this decision has been made, I think what is really important is to identify how do we mobilize the resources that exist, how do we mobilize the options that are available to be able to help parents understand how to talk to their children, how to ask them questions to identify what they're thinking, what they're feeling, so that they can provide information and reassurance, find out what they're missing about being in school, and be creative and identify ways to help them fulfill those needs, establish routines and structure, and again, reach out to schools, to teachers, to counselors, because it is possible to get guidance, to get help, and again, to, as I mentioned before, to deploy telehealth services to help families, to help parents, and to help our children.
Dr. Barone, we'll have to call it a conversation. Thank you very much for making time for KUSI.
Thank you for having me.
All right, I'm sure we will chat again in the not so distant future. Many business